What happens to the fat that we take out? Will you get fat in the same area that we removed? And the answer is no. We put so many fat cells in there and we'll remove them. So upon removing them, they will not accumulate again in that area. Granted, there's probably still 20% of the fat cells there, so they can gain some fat, but they're not going to reaccumulate fat in that area. Now what happens, and we talked about this a little bit earlier, what happens is when you take fat out of certain areas, it may come back to other areas. The two most common areas are, number one, breast tissue. So if you actually liposuction a lot from the abdomen, a woman may gain 1 or 2 cup sizes, which in some cases they're happy about that. In some cases that's not something they really want to occur. The other thing is it may increase, it may go to the bottom, it may go to the butt area. And again, those are issues that just have to be understood. Sometimes people are very happy about it, sometimes they're not. But the bottom line is it won't go there unless you gain weight. So if a person has liposuction and gains 20 pounds afterwards, those are some areas it would go to. So just to be aware that that might occur. And let me also talk about cellulite. What happens is cellulite is when you have little, we're talking about the cellulite is like when you have little fishing wire or fishing string that connects the skin surface to the fascia below. And when there's a normal amount of fat, it doesn't dimple. But when the fat increases, that attachment to the skin is still present and it causes dimpling. So what I've done is she has a little area in her arm, in the outside of her arm, that she's concerned about cellulite. And I can actually separate the cords from right underneath the skin, and that will reduce that cellulite appearance. That can be also be done in the buttock area and the hip and thigh area. Those are also other areas that can have cellulite and can present with an issue. And it can be actually modified by just separating those cords. So, what is minimally invasive? A lot of plastic surgeons don't have minimally invasive experience. And that means being able to do something through smaller ports, smaller holes. My background is early in the 90s, we started doing laparoscopic cholecystectomies, meaning doing an entire gallbladder through a small little hole in the tummy and one in through the belly button. And those results came out very nice. So I started off learning that. I also learned how to do thoracoscopic, or learning how to remove lung masses through little small incisions, little small ports. So that's minimally invasive surgery, not doing a tummy tuck where you make a cut from one hip to the other, take your belly button and move it around. That's not minimally invasive. So minimally invasive is to try to do these procedures through the smallest access ports. In my other training then in cardiac surgery, I learned how to do minimally invasive bypass surgery. It was called a mid-cab, and you could actually do 3 or 4 vessel bypass through a small little hole this big in the chest. So we didn't have to break the chest. We did the same thing with aortic valve replacement, with robotic mitral valve replacement. So that's minimally invasive. So the advantage of minimally invasive is smaller holes, less infection associated, less pain, quicker recovery. And that's in fact what our approach is here. To remove this fat through the smallest number of holes, and the smallest holes that they seal up, and they almost look like little freckles when they're done. So there's no major downside. She'll probably be running around tomorrow feeling achy in her arms. She's not going to want to go out and play tennis or anything, but she'll be achy in her arms, and by the following day she'll be able to get moving around and doing things without any problem. And that's because we're doing it minimally invasively, not making, like for instance, the tummy tucks, they do a cut, you're wearing garments for 2-3 months, you're basically a week to recover. When I do an abdominal liposuction, people are back up the next day. You know, I had one lady went out and ride her bike 20 miles because It's through small holes, minimally invasive, lowers the risk of infection, lowers the risk of pain, and speeds the recovery.